Hi, I'm Dr. Bhargava. Welcome to this short video where I'm going to show you some examples of misregistration on PET-CT. Misregistration is common on PET-CT images as PET and CT are acquired at different time points, although in the same scanner. Here is our first patient, and on this slide we have multiple images. The whole body image on the left is from a PSMA PET-CT scan in a patient with metastatic prostate cancer. We see sites of metastatic disease, and they also have brain mets. We see physiologic uptake in the lacrimals and the salivary glands. These brain mets are seen here as hyperdense foci on the transaxial CT of the PET-CT. But when we look at the fused PET-CT image, we find that the location of increased uptake on PET is slightly different from the hyperdensity that is seen on the CT. And this is what misregistration is, when the location of radiopharmaceutical uptake is different from the anatomical localization by CT. Here is another example. On the left is the whole body image from a PET-CT scan in a patient with head and neck cancer before treatment, and we see uptake in the primary, metastatic disease in the left side of the neck, and then a focus right here which was thought to be metastatic disease from the head and neck cancer to the liver. After their chemoradiation, the uptake in the primary and the metastatic nodes has gone away, but this focus in the liver persists. This focus corresponds to hepatic segment 6 on the fused PET-CT image, but on a diagnostic CT of the abdomen and pelvis, it is seen as this irregular enhancing focus inside the gallbladder. And patient underwent cholecystectomy, and they were found to have an intracholecystic papillary neoplasm. So this is also a good example of misregistration. Here is our third patient, and these images are from a gallium-68 dotatate PET-CT in a patient with metastatic neuroendocrine tumor. This large mass in the mid-abdomen is the primary, and these two foci are metastatic. So when we look at the fused PET-CT images, we find that there is focal increased uptake in the right lung base, and the second focus corresponds to the liver. And here is the PET-CT image showing the primary. And so is this focus, which is in the right lung base, really in the lung, or is it just projecting in the lung? All right, so on this slide, we have images from the contrast enhanced CT showing that this focus that was projecting in the lung right here is actually in the dome of the liver. And so the diaphragm is the site where misregistration is frequent, and that is because the CT part of the PET-CT is acquired with a breath hold, and usually it's in a state of inspiration, but the PET-CT in that bed position is averaged over several respirations. In a particular bed position, we acquire for about 3 to 4 minutes, and in these 3 to 4 minutes, all the breaths are averaged. And because the position of the diaphragm is different between the PET and the CT, misregistration is very frequent in the region of the diaphragm. Just like we see in this case, this focal uptake projecting in the right lung base appears to be lung metastasis, but on a contrast enhanced CT, we find that this is at the dome of the liver. Thank you for watching.